Hello, everyone. Welcome to Live from Hong Kong. Learn from HKU experts about the COVID-19 pandemic. Today, our topic is Public Health Education Matters. If you're watching live, please share this right now. Please tag your friends. We're on Facebook, we're on Twitter, we're on LinkedIn. If you're watching it later, you can continue to share it and also tag your friends. This is going to be a very important discussion, and we want to reach your friends around the world. Please also tell us where you're watching from, because we love hearing where you are. I just want to tell you that you can follow us on Facebook, HKU100, and on Twitter, it's HK University. And the website is fightcovid19.hku.hk. The hashtag is HKUCovid19. And please email us, fightcovid19@hku.hk. We have people watching around the world, and we're so delighted that you're with us. HKU COVID-19 is the hashtag. Please post your questions and please share with your friends and family around the world. This is Live from Hong Kong. Learn from the University of Hong Kong experts about the COVID-19 pandemic, and we're going to be talking about public health education. Please stand by. Hello, everyone. It's 9 p.m. in Hong Kong, 2 p.m. in London, and 9 a.m. right here in New York City. Welcome to this live global conversation about the COVID-19 pandemic. My name is Sri Srinivasan, and I'm the Marshall Loeb Visiting Professor of Digital Innovation at Stony Brook School of Journalism. I'm honored to moderate this discussion brought to you by the University of Hong Kong. This is part of a series for everyone to learn about coronavirus from different perspectives. In the last episode, we spoke to Professor Daniel Chua and discussed how music can help with healing at this difficult time. We also met Professor Doug Arner, who runs Asia's largest online fintech course, to talk about how fintech can sprout and grow in the middle of this pandemic and as the recovery starts. Today's show is with Dr. Janice Johnston about public health education, where we are and where we go from here. Let me tell you a little bit about her, and then we're going to show you a little video about her as well. Dr. Janice Johnston is the Deputy Director for Education of the School of Public Health at the University of Hong Kong, and she's the Division Head of Health Economics Policy and Management. She has worked for the School of Public Health and its precursor, the Department of Community Medicine, since July 1990. She's conducted extensive research on undergraduate and postgraduate education. She specializes in the field of health policy and management. In recent years, she has focused on developing the tools to evaluate health service models such as the quality of care and healthcare accreditation, workload, and teamwork within multidisciplinary teams, human resource management, and more. She's an expert researcher and a beloved teacher. Here's Dr. Johnston in action at her school.
I often get teased by my colleagues that I'm the mother of MPH. I am very fond of the students who attend our program, and there have been many students who have made an impact on me in their ideas, their expressions, their attitudes towards public health, their expectation of contributing back to society and making the world a better place.
There you go. I hope you got a nice understanding of at least some of the work that she does. And now we're honored to present our conversation with Dr. Janice Johnston. Hello.
Hi.
How are you?
I'm very well. Thank you very much for having me.
It's late in Hong Kong. It's 9 p.m. I was hoping you'd be calling in from your home office, but here you are still at work.
Yeah, I'm still at work. That's true.
Well, we're very grateful to you for being with us. We start every conversation asking a basic question. How are you? How's your family? How's everybody doing?
I'm very well. I've just come out of quarantine, so I'm assuming I'm very well. I've been told I'm negative, so that's okay. My family's all in Canada on the West Coast and on Vancouver Island, to be exact. And there are no COVID cases on Vancouver Island, and they're all very well.
And tell us about why do you think that there are no cases there now? Was it worse before? Has it gotten better?
Well, Vancouver Island is a large island with a very small population, actually, maybe 500,000 people, so it's quite dispersed. The largest city is Victoria, which is about 350, 400,000 people. So, number one, you don't have a whole lot of close contacts, and you probably don't have the kind of immigration that you have in the States. However, the real reason that British Columbia has done so well is because of the chief medical officer, and her name is Bonnie Henry, and the other people that are working in public health in British Columbia, because they've done an exceptional job managing the problem in British Columbia.
Tell us about this article we're looking at.
Well, this article from the New York Times is the second or the third the New York Times has published about Bonnie Henry, and it talks about her perspective about how to manage people at a time of crisis like the pandemic. And her key phrase, which is something that comes across every day in her daily briefings that she gives in the province, which is be kind, be calm, and be safe. And this just completely characterizes her approach to the whole management of the public health crisis. She's extraordinarily calm in her presentation. She is very clear about the facts that she delivers, and she's empathetic. She understands what she is asking people to do, and she provides people with the tools to be able to comply with what the government is asking them to do. And I think this is why she's been so successful.
That's really good to hear, and we'll be hearing about some of the things that you're working on as well. Leadership matters, as we've learned in the United States, that
Absolutely.
leadership affects the outcomes that we all have. And that's why it's so important to think about those things. Let's make sure that everyone who's watching is able to tell us where they're watching from. If you have a question, please let us know as well. We love to do what we call that global tour. We see folks from around the world, and they get to ask you questions. I also hope your family is watching in Canada as they wake up this morning.
No. They don't know I'm doing this.
Oh, you didn't tell them. Okay. So anybody who knows Dr. Johnston's family, tag them, because she didn't tell them. But they can also watch it on a recording. So hello, Dr. Johnston's family out in Canada. We're glad to have you with us. She does so many of these, so it's not a big deal. But for us, it's a big deal to have her with us. So thank you. And let's get to the questions. We have lots of things that we want to talk to you about. First, if you can tell us a little bit about the school, and what is public health education, and how does that fit in with overall healthcare, medicine, etc.?
Well, the School of Public Health and public health education in Hong Kong is a little bit different than perhaps you would find in North America. And that's because the School of Public Health is actually embedded within the Faculty of Medicine. So in North American environments, usually the School of Public Health is an independent sort of standalone school. And medicine, or medical education for doctors, doesn't usually include a lot of public health. Doctors who are interested in public health may come or may go and take public health training after they finish their medical degree. In Hong Kong, public health education is an integral part of MBBS training. And we do a lot of teaching in the undergraduate medical curriculum here at Hong Kong U. But we also have run a Master of Public Health program for more than 20 years. And we have a large number of graduates. Many of those graduates are from mainland China. And we now, just this year, have introduced a new undergraduate program in global health and development. So we have our first cohort of students going through this year. So that's what our university level education is in terms of public health.
Thank you for telling us that. It's, as you said, it's different in different places. Why do you think Hong Kong adapted in this way?
Because we follow the British colonial model. Right. So in Britain, medical education is an undergraduate entry education. That's not exclusively true in Britain anymore, but that was the original model. And Hong Kong, being a British colony at one time, has followed that model.
All right. So let's talk about who needs public health education? It sounds obvious today with everything that's happening, but why is it important and where does it go from here?
Well, the flip answer is that everybody needs public health education, but that's really a bit rude, don't you think? But to not be flip or rude, the most important reason, and I think this has been very clear in COVID, why do we need public health education, or why do we need to understand health, or why do we need to be health literate? And I think that's the underlying statement, is not to say everybody needs public health education, but people, all the people in the population needs to be health literate. And that's really clear right now, particularly in this time of crisis. And that is because we have a whole bunch of things going on, and we desperately need people to understand what actions they need to take to look after their own health, to look after the health of their loved ones, and also to help look after the health of others in the community, so that we have both our individual concerns and we have the concerns of others in the community, which is obviously a core tenet of public health, is this concern of populations, or the concern of peoples within a community. So public health education really needs to span all of our education activities, whether we're in kindergarten all the way through university education, because it's very important that our population is health literate. And with health literacy, what we hope people are able to do is to use that knowledge to make informed decisions, and so that they're not so swayed by fake news, or they're not so swayed by perhaps political agendas that are pulling them one way or another, or that kind of thing, that they're actually able to discern what is the correct course of action to take, and whose advice or whose direction they should follow, and make their own best independent decision about the advice that they're given.
Folks, if you're watching right now, we're having a wonderful conversation with Dr. Janice Johnston, who's Deputy Director at the School of Public Health at the University of Hong Kong. Please share this with your friends. Please tag them. They'll learn a lot. We're also going to do right now what we call our global tour, where we see who's watching. People are commenting. I hope people will continue to do that. Let's see who's watching. We'll just go into the comment section and take a look. I see that Spin It Social says, really interested in hearing what Dr. Johnston thinks about the latest predictions for a spike in the fall. We have Ashok watching from Mumbai, and we have a second Ashok right after that watching from Kerala in India. Have you been to India?
Yes, but to Delhi, not to Mumbai.
Right. Let's keep going. Bonnie Lamb says, thank you, Janice. So nice to see that. And Stefan, who had tweeted earlier, now is here on Facebook with us. And he says, greetings, Dr. Johnston. Love Vancouver Island. Good to hear how well British Columbia is doing with the pandemic. Love everything about the region. Would move there in a heartbeat. My son, too. So here's your chance to give a shout out to that part of the world.
Yes. It's God's country, so they say.
And later, I'd love to hear your journey on how you ended up in Hong Kong in a little bit. Jackie says, thank you, Janice. And Rajendra is watching from Jersey. And you have a viewer in Kerala, India. My mother is watching, and so happy. Hi, Amma. Great to see you. Sorry, we're not with you in Kerala right now. And Arjun's watching in Jaisalmer, India. And Lawrence says, I was Janice's student in the Masters of Public Health. Miss her class a lot. So I like that. And Bernadette says, Hong Kong is known for its lack of elderly homes. And so can you talk a little bit about that? What can we do to help the elderly and older population in Hong Kong and elsewhere?
Bernadette's question is very long.
Yeah, no, so just talk in general, please. Don't worry about that.
Okay, the elderly home issue is a very interesting one, and I can't speak clearly to what's gone on in Hong Kong because I've been away in Canada for several months looking after my own elderly parent. But I can tell you what has happened in British Columbia about elderly homes. And certainly the largest outbreaks in British Columbia were in elderly homes. And the likelihood that this occurred is lack of training, lack of protective equipment, and a lack of screening of people who came in the door. So they were too slow in intervening within the elderly homes and had such a vulnerable population that when infections began to appear in the elderly homes, they weren't able to get a hold of it quickly enough to stop it. So why has that not happened in Hong Kong? I would guess it has to do with how quickly Hong Kong intervened and how carefully Hong Kong has been about the chances of people having contact with each other. And I would guess that it has to do with all of the careful interventions that the Department of Health have put in place, and those have protected people in elderly homes in Hong Kong, where they have not been put in place elsewhere, and then these vulnerable elderly were not protected.
Thank you. Rosanna is watching in Miami Beach and says, good morning, and very interesting conversation. So thank you. And my mom says, very interesting talk. So you've gotten greetings and compliments from Miami Beach and Kerala. It doesn't happen every day to people. So
Yeah.
and good wishes for your family. As you mentioned, you were taking care of an elderly relative. So we wish you the very best. Let's go to some of the other questions that have come in. Hong Kong has been doing very well with the pandemic. Why is it that Hong Kong has done so well? And what should we do? What can we do to learn from Hong Kong right here in the United States and around the world?
Well, I would take my comments actually directly sort of from Ben Cowling, who is a professor in our school. And Ben has done research in this area as to why we think Hong Kong has been so effective in, particularly as we haven't had, or Hong Kong has not experienced such a harsh lockdown as maybe some other jurisdictions have. But mostly, according to Ben's research, is because of quick action on the part of the government to implement positive controls, but also positive controls that people could adhere to. So this is also what Bonnie Henry has found in British Columbia, right? That you put in place and explain to people why you need to put these in place, and you give them the tools in order to follow through. And you don't give them conflicting messages. And that's exactly what's happened in Hong Kong. So the other thing that is important in Hong Kong is that I was here during SARS. Many people clearly remember SARS in Hong Kong, and SARS was a very difficult experience in Hong Kong. So 2003 is well embedded in memory here. And so the population already has that built in. It already knew that when we get a crisis like this, there are certain actions and behaviors that are really needed to contain this pandemic situation in order to protect everybody. And so people were willing to adjust their behavior to that which is required in order to protect themselves, protect their families, and protect their community. So, in other countries where you haven't had that direct experience, or whether there may be not such a strong commitment to community engagement or protection of community as opposed to protection of self, you haven't had that strong a reaction or that strong a commitment to those necessary behavior change.
Thank you. That's very helpful. Let's talk about a question around the proliferation of myths and misinformation on health issues. How does public health education help the public figure out what's real and what's not?
I think that may be one of the most important aspects of public health education, whether you're talking to children in primary school or whether high school students or university students. So to me, the whole role of education, not just public health education, is to teach people to be critical users of information or critical consumers. And what we want to give students, any student, is the tools by which then they can discern the validity and veracity of the evidence or the information put in front of them. So in public health, we call that evidence-based practice, but that's just a name that describes, certain public health activity, but evidence-based practice, evidence-based decision-making, all of that can be applied to all kinds of decisions that we make during our life about all kinds of health issues, not just the pandemic, but that's a primary goal of public health education.
Thank you. Let's see what else we have here. How do you build trust in the among the public for what comes out of government, what comes out of doctors and other experts?
Again, I could give you quite a flip answer, and I'd say tell the truth. So to me, trustfulness comes from truthfulness. But you know, truth needs to be presented in a way in which people can understand that truth, okay? That doesn't mean we lie to them, but we present them information in a way that people can indwell that information, take it in, listen to it, use it, measure it against their own life and against their own circumstance, and then apply it. But telling the truth has to be the first most important item to trust, right? You don't tell me the truth, I am not going to trust you. And once you lose that trust, right, what do you have? You can't get people back.
And that's
so
the hard part, isn't it?
They must focus on trust, and they must focus on truth-telling.
But we've seen so many governments and others, because they have other interests, are doing the wrong thing, right? They are not being truthful. And then when they try to be truthful, people don't understand the difference. Do you have any tips on how we can tell when someone's being truthful and when they're not?
Discernment is a very difficult tool, isn't it? I don't know if I have anything specific, but I think you have to learn ways in which you measure people's veracity. You have to, in public health, we can teach people, if they're looking at a scientific paper, we teach them basic skills about how to assess the validity of a paper. So you need to use those kinds of basic skills to assess the validity of what anybody's telling you, right? At any time. And that's what we want people to be able to do. You know, are you telling me the truth? Are you telling me the truth consistently, or do you tell me one truth today and another truth tomorrow? And then when I hear that, now I know I have no veracity, and I can put little faith in what I hear from you. And then we lose the ability to change people's behavior. And in this situation particularly, the most important thing we do at a population level is help people manage their behavior. And we leave the viruses, the vaccinations, the diagnostic tests, we leave all of that up to people who have more expertise than us, because they have the skills to do that. But at the community level, we want to help people manage their behavior. And in order to do that, we have to tell them the truth.
What is the most outrageous piece of misinformation that you remember seeing in the middle of all of this?
Yeah, that it was going to go away tomorrow, right?
Yes. And that the warm weather would make it go away. It looks like the warm weather has some kind of impact, but I think the problem is that we don't know all the answers to this, right? We had some of your colleagues from the University of Hong Kong who are the world's leaders in these issues around SARS and pandemics and all of that. And they said, we don't know. And it takes a lot of confidence to say, I don't know.
Mm-hmm. And we still don't know. And so what does that require public health people to do? We don't know. We need to tell people we don't know, but not in a way that frightens them, not in a way that, we sort of drive them to the charlatan who's selling apricot seeds or whatever, like they did for cancer many years ago. But we tell them in a way that is bounded around leadership, and that leadership allows people then to deal with that uncertainty, right? But to deal with that uncertainty with some confidence that people who have more experience are able to follow through and help keep the community protected with the best knowledge that we have at the time, making the best decisions we can make at the time.
Yeah, you're right. We have a question that's come in from Arjun, who says, public health education at primary school, what a great idea.
Yes, we need it. We need it. And it's not just sex education, you know, this is all kinds of public health education. It's mainly about decision making. What decisions are little children able to make to understand their world? And we have to graduate all of those educational activities as people mature and grow and are able to take on more self-care and more self-responsibility for their environment.
Can you tell us how you teach at that level, that age and that level? Public health education, how do you do it? And how do you keep them engaged so that they understand? I think we've gotten a lot of public health education for the youngest kids, you know, just washing your hands and singing happy birthday. All of it is part of that, right?
Well, okay, I'm not a primary school teacher, although I have to admit that I taught grade 2 at one point.
Oh, well, that makes you a primary school teacher.
Not successfully, not successfully, but it was part of my early work experience. But I think education, there are some core aspects of education that are probably fit across all age groups, and that is engaging people, right? So to engage a child at the level they're at, to engage them at the level they can understand and then interpret and then apply. Right? And how a primary school teacher does that will be slightly different than how we do that with adults in postgraduate education, but the principle still applies.
Okay, we have a question from the UK. Fiona has a question for you. And there's still a big debate here on when to open up schools. Understanding that Hong Kong schools are starting to open up, what measures are in place to protect children?
Yeah, social distancing. Face mask.
Washing your hands, right?
Wash your hands. I mean, we have all this practice in Hong Kong, huge practice starting from SARS through several flu epidemics. So the children just know there are sinks outside the school. They know they wash their hands. They know they have their temperature taken. They know they wear a face mask. This is just absolutely part of going to school, and it's not a problem. And you don't see children running around the streets in Hong Kong ripping their face masks off because they don't want to wear them, or taking hats off, which you would see in North America, because they would refuse to wear their hat, right? Or they would be objecting to wearing a face mask. But children here, this is part of their life, part of their socialization, and this is just what they do. It's not a problem.
Well, we're glad to hear. We're glad to hear that. Let's take a look at some of the other comments. People are watching around the world. Please tag your friends. Please hit share. We have a few minutes left with Dr. Johnston. We are talking about public health education and why it matters. She's at the University of Hong Kong, Deputy Director of the School of Public Health. And we want to hear also from her journey about how she ended up in this role and what this means to her in terms of work. But let's take a look at who else is commenting from around the world. We see lots of comments coming in. So I'm just going to look over here at the screen. And Esty says, hello. Esty says, thanks for your great class in the MPH course. So
Thank you.
That's really nice. And we are seeing Lawrence also had a comment. Instead of taking the whole Master of Public degree of Public Health, any good suggestions for non-medical people to learn more about public health? How to build that science literacy? So great question from Lawrence.
Okay, instead of taking a master's degree, well, if we talk about undergraduate students, and if they don't want to be in the global health and development, like if they don't want to specialize in this field, they can always take the minor, okay? Or they can take elective courses in global health and development, and that will give them good exposure to public health and to certain aspects of public health. In terms of the local Hong Kong people, they can take individual courses within the master degree program without taking the whole master's degree if they're, this is not something that they want, but they want some exposure perhaps to infectious diseases or to understanding how modeling works or how do we come up with all these great predictions and forecasting and things like that. So there are many ways in which people can do that. Also, I tell them, go to Coursera, go to edX, go to any of the big platforms that run online programs, because there's a phenomenal number of very, very high quality programs there that people can take and learn on their own time.
Got it. I think a lot of people will be paying attention to that. Do you have a sense of where it is the growth in public education is going to be as you look at the future of this? How are you planning for your institution?
That's a very interesting question, and I've asked that of several people lately. And I've also been part of a large leadership group in public health education online that we've met every week for several weeks. And these are very senior deans in the US that are meeting and talking about public health education. And I think in terms of a master's degree in public health or public health education itself, probably what's most striking that's come out of the current crisis is systems reform, health systems reform, and building stronger health system capacity and building stronger public health workforce capacity. And so I think that will be the direction in which we will sort of modify or change our program to draw on those strengths. And I would expect that we will see that worldwide.
Thank you. Question about Hong Kong. The government is about to reopen Ocean Park, and the book fair will be held as scheduled. I guess the big book fair.
It is huge, yes.
Would it be too risky at this moment to do that, or how do you think they can stay safe?
Well, the government has a strong policy of social distancing, so my expectation will be for example, when I was in Canada these last 2.5, 3 months, if I wanted to go to Home Depot to buy something to fix in the house, I had to stand outside in a line, separated by 2 meters, and they moderated the number of people that went into the store at any one time, and you all had to keep your distance, and you all had to wear your mask and all of that. And I would expect that that's exactly what they will do in Ocean Park, and that they will do like they've done in New York, block off seats so that if you're on the roller coaster, you're not there'll be a row in between you that's blocked off. All these kinds of things we can put in place to ensure we have these sorts of social distancing and help people then enjoy going to Ocean Park, but also practice safe distancing from each other, and then people need to remember to wash their hands and not take their face mask off.
All right, let's talk a little bit about your own journey. You're Canadian, you're now in Hong Kong. Talk about that and how you decided, and when did you know this was going to be your life and work?
Well, I started out as a dietitian. I trained at the University of British Columbia, and then I lived overseas, or I worked in the Prairie provinces in Canada for a couple of years, and then I lived overseas and worked in Germany for a couple of years. After which I did my master's degree, and then my family actually came here to Hong Kong in 1997. And because my family came here to Hong Kong, I came to Hong Kong. And I had never really considered doing a PhD, but it's a bit serendipitous. I don't speak Cantonese. And because I don't speak Cantonese, I couldn't work as a dietitian in a hospital in Hong Kong. And someone suggested to me that I come and speak to Professor Anthony Headley. He's now deceased, but I came and spoke to Professor Anthony Headley, and he said, "I'll hire you on the spot." So I was hired on the spot, and I just started doing research work with him, and one thing led to another.
And
that's
what do you miss about Canada living in Asia, and what do you appreciate about Asia that's different from North America?
Well, you might find this a bit funny. When I got married, my father-in-law said to me the day I was married that there is beauty everywhere you live, and you will be happy everywhere you live. And that has been absolutely true. And when I came to Hong Kong, I did not pine for Canada because I think it's a waste of time, actually. I have lived in many different places and done many different things, and I don't pine for what is behind me. I enjoy looking forward, learning, and meeting and doing with the people I am at in the place I am. So I don't pine for Canada, but I am delighted to go back and see my family.
I love your attitude about not looking back, always looking forward. I think that a lot of people spend too much time looking back. Let's look at some of the comments coming in. Mark is watching in Durham, North Carolina. And Rajendra says, could you address the issue that medical experts appear to have handed over the effectiveness of the N95 masks against cloth masks when dealing with viruses? Talk about the masks, please.
I really don't have the expertise to actually answer that question. Sorry.
But I will say that in countries in East Asia where they're used to wearing masks long before the crisis, have had better outcomes. Certainly, we've seen that. And Twyla, watching in New York, says, strange that people don't intuitively understand why public health education is necessary.
I would agree. It is strange. I would agree. But I think that maybe is a failure of public health, in that public health hasn't made it clear why they're important, right? Bonnie Henry, in a talk a few days ago, described it as a bit being hidden in the wood. Well, that's our fault for allowing ourselves to be hidden in the wood. And we should not allow ourselves to be hidden in the wood, or allow ourselves to be the invisible medical profession, right? And this is something we should correct and make ourselves more upfront and more engaged with the public and more engaged with our community, so that we're not hidden in the wood or invisible to the public.
I had not heard that term, but is that something that's bandied about in the profession, that they're the...
I haven't heard it before either. I just heard Bonnie Henry say that.
Okay, but it makes perfect sense that could be the situation. Monima says, thanks for such an insightful discussion so far. What are the mental health impacts of COVID, if any? And I'll direct our watcher, our viewer, to a really important conversation we had with one of your colleagues who's a mental health expert about that. But we want to just hear, what are the public health aspects of mental health?
So I didn't hear the interview you had with the mental health experts, but I would guess at the moment we don't really know, and these are things that are coming, and they will be coming down our pathway, right? And these are things that probably relate to the stress, the inherent stress of this situation, of people being locked up at home, people being worried about their children. We know there is an increase in amount of domestic violence and child abuse. We know all of these things are happening. But I would guess at the moment, we don't absolutely know, or we don't have a clear picture of what the mental health outcomes are. And that was true with SARS too. It took a period of time to know what all the mental health outcomes are. The important thing is we know they're coming, these outcomes. So we need to be ready, and we need to think about, how are we going to deal with this in the community? How are we going to support children who are frightened or stressed or don't know what's happening next? How are we going to support young adults who don't have a job, who are graduating from university and can't get work? How are we going to deal with these stresses in our society? This is an extraordinarily important public health problem.
Thank you. Macy says, thank you so much for this. Can you please tell us about public health research at the University of Hong Kong?
Oh, well, we are very, very strong in infectious disease research, as I suppose people already know. We've also have a new arm of research here on antimicrobial resistance, which is just developing. But we also do a lot of other research. So in my division, we do a lot of economics research, policy-related research, looking at health systems organization, looking at organizational behavior, those kinds of things.
Thank you. Mark says that when he was in grade school, they used to teach public health in our school system in North Carolina as part of health education. I don't know if they do that as much anymore. Yeah,
I'm not an American, so I don't know.
we think the Canadians do everything better, so we presume that they.
Well, it's correct, absolutely.
Archie says, I'm a teacher and would love to share this talk among other teachers if possible. Absolutely, it will be. It's already being recorded, and as soon as we go off the air, it'll be recorded and available to you. You can find us in multiple places, including the fightcovid19.hku.hk website, and on Twitter and Facebook. It's all there. So please share this. Tag your friends right now. I'm learning so much, and I know you will too. So please share this. And Bonnie says, thank you. Your sharing is inspiring. We do need to stay happy and healthy anytime and anywhere. And Mark has learned that their famous zoo will be opening with some newer and serious restrictions. It'll be interesting to see how tightly this will be enforced and where that all goes. This is something that I think everybody's worried about, the reopening, especially in America, where we are terrible at following directions or listening to authority.
Sorry, I missed that. What did you say?
No, I was saying that in America, we are very bad at listening to authority when it comes to things. So we're worried about the reopening.
Yeah, I think reopening is frightening for everyone. Just when I left British Columbia, they were just beginning to reopen. I think outdoor coffee shops. Yes, you couldn't go into Starbucks, but you could have your coffee outside on the plaza sort of area. But people were so excited that, there's a long weekend in May, like your Memorial Day weekend in Canada. There's a long weekend in British Columbia. And they were so excited to be able to go outside and so looking forward to it. And I think as the weather warms up in North America and people, are coming out of the winter cold, that really is just part of their psyche that they want to get outside. And so trying to manage that from a public health point of view of dealing with people's real need to get out to the sun, get outside out of gray winter weather, and then enjoy their a little bit of social contact. And I think this is all something you have to understand and you have to deal with. And that's why I think the effective public health message for people is, yes, we need to be calm and we need to be safe and we need to be kind. And how do we do that? Within a setting where we keep everybody, we look after everyone and not just our own individual need.
All right, I think we're now ready to see another video that's from the University of Hong Kong. Let's take a look.
We have well over 1,200 alumni. All of the alumni are actively engaged in the field of public health. And of course, an important subset of that group is working directly with COVID-19 and working in Hong Kong to make Hong Kong a healthier, stronger, safer place in this time of stress and anxiety over COVID-19.
That's a great video. I want to ask, where were you standing? What was going on in the background?
Well, all those mascots. I'm standing outside the big lecture theaters, or what's called the conference hall at the university and the medical school. And all those mascots, each school has its own mascot. So that's our school mascot. And I just thought I'd stand beside the mascot and have company.
What does the mascot represent?
Just the different aspects of public health. One of them is on modeling. One of them is on infectious disease. And there's one other, I can't remember. There's one other symbol that they have there, but I've forgotten what it is.
Tell us about your graduates. Where are they? What are the kinds of jobs they're getting? And it must be in big demand coming out of this.
Yeah, they are. Hong Kong, again, quite a different environment from the US. Okay, and our student population is quite different. So we are primarily, obviously we're primarily Asian, and we don't have very many students that come from international locations. We have some, but about half of our class is from mainland China. And they go back to China to work. And most of them are working within sort of CDC environments or local or regional or provincial sort of CDCs, or Center for Disease Control, because they have them at different levels within the country. Many of them, or a number of them, also work for different corporations like different drug companies or different other different agencies that are providing healthcare. My most recent PhD graduate works for one of the big government agencies in Beijing. So we have graduates everywhere actually now. And our local Hong Kong students, the majority of them are already working. And so they're coming to get a degree while they're working, and most of them return back to their place of employment.
Mark has a comment, says, on a lighter note, you share your name with the founding member of the band Taste of Honey. I didn't know if you know that. And so he's asking if you have any musical talent yourself. The name of Dr. Jan was, the name of the singer was Janice Marie Johnston. And yes, that's right. It's very close. Your middle name is Mary. So he's asking if you have any musical talent.
Well, I sing, but I don't know if that's musical talent. So,
Of course it is. Of course it is.
and I
We
love
won't
singing.
ask you to do it now, but we did
No.
do a concert as part of this series with the music department. So maybe one day we'll get you to do that. We're almost out of time here. What is your message for anyone who's watching to understand why we are where we are in the world? And also, if you can, tell us a little more about the program and who should apply and why they should think about the University of Hong Kong.
Well, I'm just going to steal from Bonnie Henry because I think this is probably the most important message. And the first one is to be kind. You know, be kind to each other. Be kind to yourself. You know, this is really calm. So when things are difficult, remember that it's not going to last forever, just for a period of time. And it will be over. It just is going to take some time. So be calm and wait for it. And it will be over. So be kind, be calm, and be safe. So follow what public health people are asking you to do, because they're asking you to do that to be safe. So those are the things I would advise you to do at any time. About our program, so we have a 1-year full-time Master Public Health program. We cover all the basics of a master's program in public health, and they're very traditional. So we have epidemiology and biostatistics, public health practice, health economics, policy and management, and of course, the control of infectious diseases. These are taught by world-renowned experts in all these areas. We have some international teachers that come in who are also world-renowned experts. We have a good-sized class. If you're in America, you can apply through the SOFIS system, or else you can just apply directly from Hong Kong U. The Hong Kong U website has all the application information, and it's an online link.
I think some people watching right now would say going to school in Asia sounds like a pretty good idea, looking at everything that's happening in America with the health outcomes. We didn't talk about it, but I can't let you go without talking about your research around working while sick and the term presenteeism. We talk about absenteeism. Presenteeism, I think, is going to be a huge factor in what happens in America. So we want to do a whole show about this down the road, but if you wouldn't mind just telling us a little bit about that research and what that means today. And I'd never heard that term presenteeism before I read your work, and it's like opposite of absenteeism, which is what everyone's obsessed with.
Yeah, it is. And the interesting article in the Financial Times about presenteeism about a year ago. Actually, I was delighted to see it. So basically, presenteeism just looks at the impact on work of people who go to work while they're sick and they actually should be at home. And this is quite common in Hong Kong. Hong Kong has an extraordinarily strong work ethic. And we surveyed about 4,000 nurses working in 4 very large hospitals in Hong Kong. These are sort of 2,000 bed hospitals each. And it's their self-reported estimate of going to work while ill, but it's a validated instrument. And we used a WHO validated instrument to measure their productivity loss related to attending work while sick. And that gives you a very clear estimate of how you might want to look at HR policies and how you might want to look at helping staff deal with coming to work while sick and showing them that, you know, we appreciate your effort, we really do. But in terms of either helping you and helping the environment, i.e. the inpatient care in a hospital, it's not the best choice of action. So the best choice of action is for the hospital to be able to replace the worker and for the worker to stay home and get better. And that's the outcome, the basic outcome of the work.
Well, I want to talk to you more about this because I know firsthand that I saw it as a mark of honor that in 3 years I worked as the Chief Digital Officer of the Metropolitan Museum of Art. I didn't take a single sick day or even what we call a mental health day because there's some kind of, I don't know, machoism, I don't know what it is, but ignorance, stupidity to just take care of myself. And you can imagine that a lot of people do that, right?
Absolutely. A lot of people do it. Exactly.
All right. Well, we've got to let you go. It's almost 10 p.m. in Hong Kong, where Dr. Johnston is. We're so grateful to you for being with us. Dr. Janice Johnston is Deputy Director of the University of Hong Kong's School of Public Health. We're very grateful for your time and your insights. We have great comments coming in from around the world. Thank you for your time and attention, and we hope you'll come back and share more about your work.
Thank you for having me. I've really enjoyed this. Thank you very much.
Thank you. And thank you, everyone, for watching. We're very grateful to you for being here and part of this show. We do this so often, and we are learning about what's happening in Hong Kong and how everybody around the world can come together. We now have a global community that has grown around this conversation. Please go into our archives and look at the various videos we have done. We have learned so much, and so have you. We've had people watching from dozens of countries every time, and it's been a real education for me. Please check out the website, fightcovid19.hku.hk, and we will see you again. We want your comments. We want your feedback. I'm on Twitter at Sree, S-R-E-E, and my email is sree@sree.net. And we'll leave you with the card so that you can make sure you've got all our contact information right on the screen for you. And with that, we'll say goodbye. Thank you very much.